Hi, I am Dr. Anjali Taneja, Principal Consultant Obs and Gynae, Cloudnine Hospital, Patparganj. So, first trimester is the end of third month. So, by this time, you have done your pregnancy test and congratulations that you're pregnant. Once you visit the doctor, your BP is checked. You will be advised to get an early pregnancy scan. This is done to check that it's a single pregnancy or twins, or the baby's heartbeat has come and there is no internal bleeding and baby has come inside the womb and not outside, which is life-threatening emergency related with pregnancy that we call as ectopic. So, ectopic is ruled out, the viability of the fetus is checked, the dates, the growth of the fetus should correspond to the dates that we are calculating by your period date is matched. Also around this time, first trimester screens are done, which include your blood group, a check for your hemoglobin, thyroid, sugar and thalassemia screen, and then screening for few infections which can be transmitted from parents to the baby, which include tests for syphilis, HIV, HPS and anti-hcv, and then urine infection is also checked for. So this is what all happens in the first trimester. Once you enter the second trimester, that is around 12 weeks of pregnancy, you will be advised another scan, and then simultaneously along with this test, this scan, a blood test is also done. Both of these tests which are done at 12 weeks, the ultrasound, which is the anti-hcv scan, this is the name that is popularly given to the scan, and dual marker test, they are aimed to find out the possibility of developing Down syndrome or any genetic problem in the baby. So these tests, they give the chances of the baby having Down syndrome or trisomy 21, that is Down syndrome, and trisomy 18 and 13. So after we have done the screening and you're low risk, you may be offered another scan at 16 weeks in some units, and then finally a level 2 scan at around 20 weeks. Now this level 2 scan again is an important ultrasound. This is done to see that your baby is developing normally, and it is an anomaly scan in which your baby is screened from head to toe for any developmental anomalies. Then after that, your visits are getting scheduled at 4 weeks, and at every visit your doctor is checking baby's heartbeat, your BP is checked, your weight is monitored and to see the pattern of weight gain, and then at around 24 weeks you will be advised a test called as GTT, which is a test to diagnose gestational diabetes, the glucose tolerance test. Along with it, fetal echo may be suggested, which is to screen the baby's heart. Immunizations of the mother also start around this time. So during pregnancy, you will receive a tetanus toxoid, Tdap and a flu vaccination. Once you are ending with the second trimester, that is around 28 weeks, you may be offered another growth scan to check that baby is growing well and the water around the baby is okay and the baby's blood supply is also okay. So the routine clinical checkups continue, in which baby's growth is getting monitored and you are being monitored for developing any potential complications. As you proceed, another scan may be advised around 32 to 34 weeks to see any developing anomalies and recheck the growth of the baby. Your hemoglobin is also repeated around 28 weeks and 32 weeks to see that you're not developing anemia, and this is what happens during the checkups. So treatment, you're giving iron, calcium, folic acid, sometimes a protein powder, and any other intervention will depend on your reports. If you are screened and you are high risk for developing high BP, then intervention may be there, or high risk for preterm delivery, then accordingly the interventions will be there. So the aim is to have a safe mother and safe baby. The entire antenatal care is basically focusing on that.